In 1928, at St. Mary's Hospital in London, Sir Alexander Fleming discovered penicillin and medicine was changed forever. This accidental discovery made it possible to treat seemingly impossible conditions witnessed by doctors in those days. Whereas in the past, when infections were automatic death sentence and on multiple occasions, the entire human race was nearly wiped out from the surface of the earth. The discovery and production of drugs did not only increase life expectancy, but also improved the quality of life. And as knowledge and technology continues to improve, we can now treat diseases that some years ago seemed impossible to be managed. And there are promising signs that even health conditions that are currently impossible to manage will not only be easy to treat, but maybe totally eradicated, as with smallpox. Unfortunately, even with the blessings of discovering drugs like this, we humans still find a way of developing bad habits. And in today's video, I'm talking about 6 common bad medication habits most people have. Some of these habits are from a place of innocence, as we would do better if we knew otherwise. Whereas some of these habits are from our own deliberate misdeeds despite our knowledge. You will find them out further in this video. Wait until you find out the 6th one, which is a habit that even health workers that are supposed to be more knowledgeable of the implications are guilty of. So let's dive right into today's video. The first habit is buying drugs from vendors instead of certified pharmacists. This happens very well in developing countries, like Nigeria. There are these drugstores that are being known as chemists, and that's where a lot of people go to buy their drugs because number one, it's cheap, it's usually more accessible, and many of them, they are posed as health workers, so they can just easily prescribe drugs and give them to you. Why this is bad is that first, you find many fake or substandard drugs in these places. These people are not health workers, they're just businessmen and women that want to sell their commodities, and they can sell anything to make money. So your life is at risk if you continue patronizing them. Whereas in certified pharmacists, you find pharmacists there. These are health professionals that can better guide you as to how to take the drugs, and if there are alternatives that fall in line with the prescription that the doctor had suggested to you, they give you. Maybe the companies are different or something like that. They give you. They work hand in hand with us to ensure that you get the drugs and get better, unlike the vendors. So please, if you are a chemist patronizer or you are a vendor yourself, stop it. You are causing harm to a lot of people, because we see many of these people eventually come back to the hospital in worse situations, either from the disease progressing without the drugs doing their work because they are obviously not supposed to function, or they suffer from complications of taking such bad drugs. So please stop it. Stop patronizing such people. I beg you. Even the pharmacy is very far from you. Go there and get your drugs. That's why they're certified. The next is something that quite a lot of people do, is people take drugs without looking out for details. You don't check the name of the drug. You don't check the dose of the drug. You don't check the manufacturing expiry date of the drugs. So you just buy it, and it's easier for you to be misled in the chemist, because standard pharmacists will not even allow you to do that. They give you the drugs themselves. So when you're getting a drug, look out for the name, look out for the dose. It might be something that you're supposed to take, let's say 50 milligrams, and you want to take a higher dose or a lower dose. It's trouble already. And if you take expired drugs, they could have very, very fatal outcomes. So if you're someone that just happens to swallow whatever drug you find, stop it. You are playing the game of Russian roulette. You might be unfortunate one day. So if you stay alive and sane and hearing this and you've been doing this, I beg you, we love you, we need you, just stop it. So walk to a proper pharmacy and check, confirm that the name is the name of the drug, the dose is there, and as at the time you're purchasing the drug, it has not expired and it's coming from a standard company too. Yes, another thing you should notice that the drugs should be sealed. Standard drugs are usually sealed, so if they are opened, thank you. The next one is taking drugs from others that are not part of your prescription. You just happen to be sick and then someone will just come, okay, I had something similar, this drug worked for me, take, and you just take it. Except it's a painkiller, which is okay. Even the painkillers, there are certain conditions that you can't give certain painkillers. Let's not dive into that. So your doctor had seen you, had assessed your condition, and had prescribed the drugs for you. So take the drugs that have been prescribed. If they don't work, you go back to the hospital. Your transaction is not finished till you get better. So if it's not working, go back. The doctor will definitely review the drugs. You find patients being prescribed drugs and then someone, a relative or a friend will just give them another drug and they will take it. There's a video I talked about, even while on admission, some patients will still get drugs from outside and be taken in combination with the drugs that had already been prescribed to them in the hospital. This is bad because number one, some drugs have drug interactions, so it could be fatal to you. The second thing is that you don't know the dose, you don't know where the drug is coming from again, you don't know the quality of the drug. Another problem. Then another thing is that you might have an adverse reaction to the drug and you don't know. So someone taking it and feeling fine does not mean you taking it will guarantee that you're going to feel fine too. So no, don't. If anyone suggests or recommends a drug for you and the person is not your doctor, please, if you think you need a drug, go and cross-check with your doctor first before you start taking it. So please, I beg you, if you're doing this, stop it. And if you happen to be the one that is the drug evangelist, a little thing, someone is not feeling fine, just go and be throwing drugs at them. Stop it. Thank you. Then the next one is something that is quite common nowadays. You find people breaking or grinding or chewing drugs that have not been instructed to them to do so. And they do this to enable them swallow the drugs. There's a reason why some drugs are in capsular form, some drugs are in tablet forms. There's a reason why health professionals recommend that you swallow some certain drugs and chew some certain drugs. There's some drugs you put under your tongue. There's some drugs that you put through your anus. There's a reason. All these drugs have peculiarities. They reach the certain place they're supposed to reach to optimally work. So if you chew or grind any drug that's supposed to be swallowed, you're already destroying the effectiveness of the drug by doing so. It's exposed to an environment that it's not supposed to be exposed to. Drugs are not pleasant things. They're difficult, so please stop that. Stop. Then the next one, this one happens to a lot of patients are guilty of this, and that's demanding that you give them antibiotics for common cold or diarrhea. It's been proven over and over again that the commonest causes of upper respiratory tract infections and diarrhea are viral. So they are viruses, and most times they go on their own. So what you do is that you give drugs to just help the patient feel better, to relieve the symptoms. You don't just start giving antibiotics for these things. Number one, they are not effective, and number two, you're abusing antibiotics, and this is one of the causes of the increasing antibiotic resistance we're having globally, because people abuse drugs. So somebody has upper respiratory tract infection, the person wants antibiotics. Somebody is having diarrhea and vomiting, the person wants antibiotics. Flagyl, you can't be taking Flagyl for, oh God. Please, I beg you, when you're having these conditions, just go and see the doctor in a good hospital, and don't worry, you are safe. So when the doctor doesn't recommend or doesn't prescribe antibiotics for you when you're having these conditions, you have met a really good doctor. Thank you very much. Then we come to the last one, which is something that health workers do. It is stopping prescribed drugs immediately after feeling better. If you've been prescribed to take a drug for a particular number of days, let's say 5 days, let's say 10 days, let's say 2 weeks, and start feeling better before then, finish it. Don't just feel like, okay, now I'm better, and you stop. Especially antibiotics. Tied into the previous act is that this leads to increasing antibiotics resistance. And what happens is that eventually the drugs that are supposed to help you when you come down with bacterial infection will be ineffective, because the kind of microorganisms in your body have already developed resistance by being exposed to these drugs. They get exposed to them, and as at the time they're supposed to die, you stop taking them, and they will now develop resistance, so that eventually when they're exposed to the drug, it will not affect them and the diseases progress. I can't count how many times we have done culture and sensitivity for a lot of patients and found out that most of the drugs we used to do the culture and sensitivity, the patients were resistant to them, so eventually you have to use very expensive drugs to treat them. So please, if you're being prescribed drugs for so number of days, irrespective of how you feel, if you like, be strong enough that you can carry the moon, finish the drugs. Thank you very much. If you are not feeling better over time, go back, as I said earlier, and see the doctor to complain. Many times the drugs are not like miracle drugs. They might not work immediately, but you go back to the hospital. Don't modify anything. Don't stop. Don't add anything. Don't reduce anything because you are feeling better. Health workers, you know this. As I said earlier, I too was guilty of this, but I had to stop too. So that's all for today's video. What do you think? Which one are you guilty of? If you are guilty of all 6, wow, you have been living dangerously. And if you're guilty of none, wow, as I said earlier, you are a saint. In this world, you are a huge saint. So if you're guilty of one or more, just stop them. None of them is good. So if you enjoyed this video, don't forget to give it a thumbs up. If you're yet to subscribe, please subscribe and turn on the bell notification. Thank you, and I'll see you in my next video.